start. Welcome everyone to the Komen, Michigan Grant Writing Workshop. We are now recording, so thank you everyone for joining us. We're going to go through two presentations today. The first will be focused on the RFA as well as our community profile, and the second will go through some of a refresher course for our grants e-management system known as GEMS. So welcome, my name is Megan Smith. I am the Mission Director for Susan G. Komen, Michigan. Some of you may have heard in January, 3 of our Michigan affiliates of Komen merged together to become Komen, Michigan. So we now have 3 service areas. We have West Michigan, Southwest Michigan, and Mid-Michigan, and it's the same footprint as we have had in the past. It's just a new name and centralizing our operations so that we can put more money in the community. We still do have 3 offices, one located in Lansing, one in Grand Rapids, and one in Kalamazoo. And we have local development and mission presence in each of those areas. And if anyone has more questions about that, I'd be happy to chat about that later. But just so that everyone's aware, our grants will still be presented, as you saw, in 3 separate RFAs. So we will have 3 separate slates for funding, and funding will be proportional to the funds, the revenue raised in the service areas. As many of you know, the single largest source of funding for our grants is our Race for the Cure series, and it's really a critical fundraising activity for us, and that's where so much of the funds that we get to be able to reinvest in your programs comes from. So our West Michigan Race for the Cure is September 19th, and our Mid-Michigan is in April, and our Southwest Michigan race is in May. So with that brief introduction, we'll start our slideshow. Oops, going to go back a slide. Previous. So we're going to start with introductions. I already gave mine. Today we have, I know on the call, a number of different agencies from all over our 20-county service area. I wanted to do a little bit of background about Komen. We're going to talk about the community profile. We're going to go over the request for applications and the changes that have been made this year, and then we'll go through a GEMS tutorial. So the goal of this workshop is to first and foremost familiarize new applicants with what Komen is all about. We also want to update our existing grantees and folks who have asked us for money in the past about the new opportunities we have and priorities. And then we're also going to go through how to develop a successful application, address some of the changes that have been made to the application process. And last but not least, I want to encourage you guys to reach out to each other and chat about how your programs can connect to each other and create a stronger web of resources for the men and women that we serve. I tried to spice up the presentation with some photos, so you'll see some of our staff showing up in some of the slides. So Susan G. Komen's promise started with a promise from one sister to another. Nancy Brinker promised her dying sister Susie that she would do everything in her power to end breast cancer forever. And over 30 years later, Susan G. Komen is the largest investor in research, aside from the government, focused on breast cancer. And we've also locally in our 3 service areas have invested nearly $8 million in community grants. So we've done a lot of work to move towards ending this horrible disease, but we need great partners like yours to be able to make sure that needs are addressed now while we're looking for those cures for the future. And just so everyone's aware, 75% of our funds stay local in community grants, and the remaining 25% go to research at a national level. So exciting news this year, you guys. We have a new Komen, Michigan community profile. Well, just about. It's in process and should be finalized by the end of the year. You'll all hear news of the rollout come spring so that we can share that data with everyone. The 2015 community profile sections that have been completed and approved will be available on the KomenMichigan.org website under Community Impact, How to Apply for Grants. And that's going to be an important web page to touch base with for resources. That's where the RFAs are posted, the user manuals. A recording of this webinar will be posted later so that you can relive this magic, and any other resources that you might need would be located there. So the community profile has two sections that are kind of the meat of it, three sections total, but the first two have been completed. So the first part, we look at demographics, breast cancer statistics like age at diagnosis, mortality rates, stage at diagnosis, and from that we identify populations in our area which are most at risk of dying. And that I believe we'll have both the full raw qualitative data report available, which has about 80 pages of facts and statistics, and we also will have the QDR narrative, which is much shorter, under 20 pages. From that information, we really want to encourage you to take a look at it. Identify your community and identify some of the issues that you have and how your program is going to address those. So if you have a really high late-stage diagnosis rate for African American women in your area, try and take a look at how your program would tie into that. So using your data very much to support your program design, because we have noticed that our needs have shifted dramatically from the 2011 profile. As many of you know who have worked in this field for a long time, access to screening was the most basic first step that we still were lacking until Affordable Care Act and Healthy Michigan Plan implementation. As a result, we've seen a lot of changes in the needs in our community. It's less about getting your mammogram scheduled, and it's more about getting it scheduled and getting the support to actually keep that appointment and continue through follow-up care in a timely manner. So you'll note that some of those things have been reflected in our priorities. In the qualitative data report, you'll also notice in the narrative section that we've identified three key populations that we recognize are underserved: African Americans, Hispanic Latinas, and our rural populations. So we're particularly looking for programs that address some of the disparities in those areas and some of the barriers to care. The programs and resources of our target communities are then looked at in depth in the health system and public policy analysis and narrative. We create a very large set of spreadsheets that identifies the resources available in the area and identifies where there might be some gaps or some challenges. And that's another important place to look at for data to support your program design. Now, as a note, we identified populations based on demographic data this year rather than geographic location, because we realized that people are hurting all over, but that these disparities, particularly in demographics, are something that Komen needs to be working on locally. So if your area was not selected as a population where, for instance, we selected 3 communities for African Americans to target. And if you aren't one of those 3 counties that we looked at in the health system and public policy analysis, you can still request funding. But we'll want to see some work in the application that says, so here's the community you want to serve, here are the resources available, and here are some of the ways that we're going to address the gaps or the problems connecting those resources to the people who need them. So just make sure to provide that same type of information, looking at your community, identifying those gaps, and showing very clearly how you're working to fill those. And then the last section of the community profile is our qualitative data section. We're currently going through this right now, so some of you might have already gotten phone calls from us for interviews. Others of you can expect those in the future to make sure that we are talking with providers about what they're seeing in the community. And then we're also hoping to do focus groups that will bring together community members to be able to share their perspectives on our healthcare systems as well. So look forward to potential calls or requests to help us try and coordinate focus groups. We'd love any help that you can provide, because after all, if we can get more feedback from your communities, it'll better inform our priorities and our community profile. So we really appreciate your support in that. It's a very long process. We're just nearing 18 months of completing it, and we're looking forward to being able to roll that out in the spring. So again, the QDR narrative, the HSPPA narrative are all on the grants website, how to apply for grants. So as you saw in the RFA, we have 3 funding priorities. Our first priority is to make sure that we have screening access that fills the gaps in existing programs. So what we mean by this is that we're not looking to duplicate programs that can serve a woman. A woman who between 138% federal poverty guideline and 250% should probably be served by the breast and cervical control and navigation program if she would qualify. If she doesn't qualify, of course, Komen funds should step in to wrap around and make sure that that woman gets the care she needs. Similarly, those who qualify for Healthy Michigan Plan should be assisted in applying to make sure that we're utilizing the resources that are provided and Komen funds are not duplicative of other services. So that might mean that your criteria for a screening program is different this year. We really want to make sure that we're addressing gaps and that we're focused on programs that fill in those gaps. And you'll see we have target communities in that area as well. Oops. Go back one slide here. The second priority is culturally appropriate education and community navigation. We recognize in the work that we've done so far in the community profile that there often is fear, myths or misunderstandings or miseducation about breast health, and that these can often not just prevent a woman from getting breast health services, but perhaps she's not tied into the health community at all. So we're finding that a lot of the women who have come to us traditionally for services have successfully been navigated into Healthy Michigan Plan or into commercial coverage or have been able to be served by our breast and cervical programs. So once those women are taken care of through other programs, we want to make sure that we're filling those open and available spaces with women who might be a little bit harder to reach. And that's really what this priority is targeting, is how can we do a community-based approach that's going to help women get into the healthcare system with the goal of having a timely screening done. So we're really focused on community-based navigation, which could be something like a community center that hires on someone with appropriate credentials to help chat with women in the neighborhood. It could be a community health worker type position. There's a lot of opportunities here and some great examples from other states that I think we could borrow for some best practices. And again, we're also looking at barrier reduction programs here as well to tie in, because we recognize that sometimes getting the appointment is not the challenge. It's making sure the woman has transportation and childcare, and that she has, appropriate translation services available to her to be able to successfully complete an entire, follow-up, if there's any follow-up after the screening as well. And finally, our third priority is making sure that we have increased availability of survivor programs. We've recognized that there are some really great programs in some of our service area, and then there's very little in many other parts of our service area. So we're particularly focused on social and emotional well-being and lifestyle intervention strategies. And there's some great research out there on some high-quality survivor programs that address some of the needs that we know survivors need. Nutrition, exercise, and self-care are all things that are incredibly important for survivorship and to reduce the risk of recurrence. So those are our three priorities. And we're going to take questions at the end. So if anyone has any, just jot those down. You can put them in the chat box if you'd like, and we'll get to those at the end of this slideshow. Okay. So next, here are some changes that are new this year. We have 3 service areas, which we already mentioned. So you will still apply under your existing username and password using your existing profile in GEMS. We're just going to manage it that way because that was the easiest way for us to do that with our systems limitations. But make sure if you're a new user, we'll go through registration in the second slideshow, but I'll point out where you would choose a different service area. We already mentioned we have a new community profile. We have new priorities. Both of those should be utilized to fashion your statement of need and justify your program design. We have a maximum funding request of $75,000 this year, which is different for some of our service areas and the same for others. We will go through next the new application design, which includes 5,000 character limits and the review process. So we have, statement of needs should have been tabbed over there, but there's those are the 7 criteria for the review process. Those are also the 7 sections of the application. So now we have an application design that mirrors the review process, which I think is an improvement. And finally, this year we are making sure to emphasize to applicants that we want a very clear and concise statement about how your program ties into existing programs, both for breast and cervical, control and navigation, and Healthy Michigan Plan, to make sure that if we have a person who's coming in for a survivor event and they really need help getting insurance, that our programs are well connected enough in their community to know where an application specialist is. That doesn't mean that that has to be part of your program design. We just want to make sure that you are demonstrating connection to resources to provide high quality care to women who might need something a little bit outside of what your program focuses, but that nonetheless we're trying to tie our continuum of care together much better. So linking our education to screening, linking our screening to survivor support and to barrier reduction programs, and making sure that we're talking to each other about what we're doing. Because one of the things we found in the health systems analysis is that there's a lot of underutilization of existing programs. So we're trying to encourage greater collaboration in that way. And you'll note that collaboration is still one of the review process categories. And additionally, continuum of care, that category we'll go through in a little bit, but that really speaks to how you connect to the other resources on either side of you in our continuum of care. So important dates for you to know. Today, you're doing the grant writing workshop. Thanks for being here. There will be a recording online, so you can watch that again for all the fun it will be. And what new this year, we have an application initiation deadline. We are encouraging you to start your application as soon as it is available in about, I think it'll be, what did I say, the 17th of September. Initiate your application so that you can get in the system, take a look at the layout, and familiarize yourself with the different portions of the application. So you'll want to go in, get your username, log in, and start an application by October 9th at 5 p.m. You'll be able to initiate an application anytime up until then, and then the system will not allow new applications to be initiated. The following week, 1 week later, the actual application deadline is Friday, October 16th at 5 p.m. New this year, we'll have our traditional compliance review, but we're also going to take a look at objectives, make sure that they are on point and being formatted in a smart way, and we'll provide 48 hours to correct any issues we have, so that can get assigned to our grantees shortly thereafter. So you'll see that we have just over a week to check for compliance. If there's any parts missing, we'll send you an email to request the corrections. So pay attention that week to your email, and if you have any questions about that, feel free to ask. Our award notification, we expect it to be before March 31st of 2016, that should say. I'm hoping that will be in February, but it kind of depends on how our budget numbers look, because we are forecasting how much money we'll have available to give. And then the award period runs from April 1st to March 31st. Our contracts will go out with award notification, and they must be signed within 30 days of notification that it's available for review in GEMS. And by signed, I mean that that's an electronic signature on the application contract page in GEMS. And when it comes to that point, we'll help you walk through the whole process. But the most important part of this is that it has to be completed within 30 days of notification. Those are the deadlines we're given from headquarters, and that's what we have to stick to. Otherwise, we can't release the funding. So the contract template that was released with the RFA, if you work in an institution that might take a little bit longer to review things, please pass it on to your legal department to help expedite approval. I think that that's really going to help us this year to be able to lay out the expectations very clearly before we even get to that last 30-day time crunch. And then once the contracts are completed, first installment checks are requested, and those are processed through headquarters now, so those can take anywhere between 2 and up to 4 weeks. So we'll get those processed as soon as possible. And one note with checks, the address and the financial contact that you provide as part of your application and the address and name that you provide as part of your W-9 submission is how the check will be sent. So make sure that those are up to date. So eligibility, we can grant as an organization to other nonprofit organizations as well as state or local government agencies. Any of our past or current Komen funded grantees must be up to date and in compliance. And the programs must be related to breast health and or breast cancer. So we're really focused on that breast cancer aspect. And then finally, you must be providing services in one of the service areas, either Mid-Michigan, Southwest Michigan, or West Michigan. If your programs happen to cross service areas, give me a call and we'll discuss what we want to do there. So here are our service area counties. We have Southwest Michigan with 8 counties, Mid-Michigan with 7, and West Michigan with 5. So your program description is now in 7 parts, starting with your statement of need and going through program design, impact, organizational capacity, monitoring and evaluation, collaboration, and the continuum of care. And each of those we'll walk through in just a moment here too for what the reviewers are looking for each of those sections. For budgeting purposes, funds can be used for salaries and fringe benefits. However, based on prior experience that I have had listening in with our grant reviewers, you're going to want to make sure that you justify that salary and why it's so important to fund a position as part of your program design. Particularly with our second priority with community-based navigation, I would expect to see a program design that involves salaries. However, many in Komen land, review land, have not traditionally appreciated funding salaries. Conversations aside, just provide that justification that says why it's so important to have this person running this program and why it's important to have that support. Consultant fees are another option for funding program expenses, clinical services and patient care costs, meeting costs, supplies, travel, other direct program expenses. We can provide equipment, but not over $5,000, and the indirect costs may not exceed 15% of direct costs. That's both in your budget and final program expenditures. So 15% max is for indirects. Funds may not be used for research, for media projects, for scholarships, construction, endowments, political campaigns, debt reduction. We can't provide funding for educational material creation. We strongly encourage the use of Komen materials. If you want to use a different material, it needs to be approved in advance of purchase so that we can make sure that it complies with Komen branding and messaging being most important. Just so you all know, Komen materials are available online for free to download any PDF, so you can print those off if you have a woman who has a very specific question. We have very specific fact sheets and a really huge wealth of material on Komen.org. All of those materials are reviewed at least annually and updated, so they're the most up-to-date. They're monitored by our scientific advisory board, and we know that it matches best practices and scientifically supported evidence-based practices. So it's really important that we utilize those. The process to actually try and create an education material involves approval from headquarters, and I would strongly advise against that route. Instead, we would love any suggestions you have to pass up to headquarters for them to create themselves, and we have had some folks partner with them in the past, years ago, to create some different language materials, so that is an option, but that should be a discussion, and generally we encourage Komen materials to be used. Breast self-exam instructions or models should not be part of the program. Komen utilizes messaging for breast self-awareness. We encourage women to know the normal look and feel of their breasts and talk to a doctor about any changes. Breast health is more than just the feel of your breasts. 6 of the 8 signs of breast cancer are actually visual. So we wanted to make an all-encompassing and broader approach to breast health messaging. And if anyone has more questions on that, I would be happy to explain the shift. There's actually a very interesting study out of Shanghai, China that was kind of the title change in the early 2000s to make this shift. So next, we're going to go over the supporting documentation. For your key personnel, a short resume is fantastic. You can also provide job descriptions, and this section is now located in the program design form on GEMS. We'll also ask you to upload proof of your nonprofit status. Your IRS determination letter is all we're looking for there. We strongly encourage the inclusion of letters of support, collaboration, memorandums of understanding. It really shows a lot for that collaboration review criteria, and it also, I think it's always nice when your partnerships are spelled out because it lays out who's responsible and that they're going to take responsibility for that section of your program design. For your evaluation, for each objective, you need to submit a affiliated evaluation form or survey or logic model, something to provide the analysis for your objective if it was successful or not. And then finally, proof of liability insurance is required. If you're funded, Komen has to be listed as an additional insured on the policy, and I need a copy of the policy. But for the application, just a copy of your front declarations page is sufficient to prove coverage. For application compliance review, we this year, as I mentioned, are making sure that goals and objectives are following the SMART format. There's a lot of really great tutorials and some awesome worksheets that you can just Google online to help you draft SMART goals. But this is an area that we really want to make sure that our goals and objectives are high quality so that our results are high quality. If your application does not meet compliance review, maybe you forgot to attach your 501c3. Maybe one of your goals was not in a SMART format. We will notify you of the problem and request correction within 48 hours. So I'll actually move the status of the grant back to application in process. You'll be able to make the modifications and then resubmit. And if anyone has questions about that, I'd be happy to answer those at the end as well. So, selection criteria. For those of you who are unfamiliar, Komen recruits a grant review committee every year. It's a committee of independent volunteers who graciously donate their time to review the applications, score them, and then meet to discuss where the ranked priorities for funding should be. We take the final list that the grant review creates. It's called a slate. We present it to the board for approval, and then the board approves the slate as a whole. And then the following month, usually, we make a funding line. We determine how much funds we're likely to have at the end of the year and what we feel comfortable granting out to maintain appropriate balances. And then we notify you of those funding determinations. But we fund down that list on that slate as far as we can go up until we run out of money. So we really rely a lot on a fantastic group of volunteers who give a lot of their time, during the holiday season to review these applications. We invite people who work in breast health services. We often have community health workers. Sometimes we have county health department representatives. We have professional grant writers. We have professional foundation staff. We have professors. And we also have survivors and passionate community members who have experienced our healthcare system from perhaps a patient's perspective. We feel that this really diverse, well-rounded group that has great representation from different geographic areas is really important to making sure that the best applications and the best programs are what are funded. So if you know anyone who's interested in serving as a grant reviewer, please send their information my way, and I will gladly send them the job description and application. And it's such an awesome thing to have an independent committee that will help determine where the funding should go. Additionally, the grant reviewers are going to be receiving the most recent two GEMS reports for any prior grantees. So if there's any issues of program performance, address those as part of your, organizational capacity section or something like that. So the review criteria is laid out in the RFA. And this is just, I wanted to walk through it a little bit. For your statement of need, focus on those target populations that we've identified and use specific data to justify your program. Try and show the review committee how well your program aligns with the funding priorities. Something I always like to remind you, these are not necessarily the same reviewers as the last year. These are not necessarily people who know what your program does. I know about your programs for previous grantees because I've been working with you, but the grant reviewers don't have that background. So your application really needs to be able to stand on its own in identifying the needs and your program design. The statement of need, I think, is particularly important for grant reviewers who might not be aware of the needs in your specific communities that you're trying to focus on serving. Program design is the next section, and it's a pretty big one. This is an important part of your application. So make sure that it connects well, that it's clear, that it's concise, and that it presents your program in a way that is easy for grant reviewers to digest. Not all of them will know all the acronyms that we use in an everyday life, so explain what HMP is, explain what BSIP is, and then you can use those acronyms after you identify it for the first time, but some of them will be unfamiliar with what breast and cervical does and how you work with them. So making sure that you give a very clear outline of your program design is important. Collaborations should also be identified as part of your program design and how you work with existing programs. The next section is impact. We want to make sure that for this section that we have long-term impacts and that we're really trying to make a big difference for the funding priority that you've identified. Organizational capacity is the next section. This is also an important section. We want to make sure that you've identified how you have all these resources available to you to be able to complete your program, or how you will acquire them, or who will support you to acquire them. Making sure that we have a good ability to manage the program that's being proposed. And additional criteria for organizational capacity. We also want to encourage you to identify any program modifications or improvements over previous years. I think that this is going to be particularly important for our screening grantee applicants. Our grant reviewers last year were particularly harsh on making sure that Komen dollars don't duplicate existing services. So make sure to address that. Monitoring evaluation is the next section. We want to make sure objectives are SMART and that we have sufficient resources in place. Collaboration is the next section. We'd like to take a look at relationship with existing programs and then also connections to other supportive stakeholders, non-traditional partners, collaborators. For some cases, for instance, for a survivor-based program, it might be that you're partnering with some faith-based communities or community centers, or that you've brought in a connection to a spa that tends to treat a lot of cancer patients. Sometimes our connections are more broad and a little bit more non-traditional to make sure that we're connecting with the right people. And I think that's also an important note for screening grantees because we're finding it's harder to reach women. So creating new community-based outreach sources to connect with the women we want to serve, that would be an important addition to this section. And then finally, the continuum of care, addressing how a woman would move through the continuum of care throughout connection with your program, and then if she needs resources somewhere else, it would be a great benefit to identify how you would connect her with a screening mammogram if it's a survivor or not a screening mammogram, but like screening services if she needs that, or other breast health services if you had a survivor-based program, or if you're doing an education program. We really want to see a strong connection to a screening source so that women are not just getting great information, but are getting great information and are getting connected to the resource that they need. And then finally, for continuum of care, we recognize that we have some very high late-stage diagnosis rates in many pockets across our 20-county area. So we're looking specifically at 60-day out definitive diagnosis, and that's something that we're going to be looking at more in the future. If you need any help, we have a Applicant GEMS handbook. We have version 1.0 and 2.0. I would strongly suggest using 2.0 as it is more streamlined. And if ever you get frustrated or stuck somewhere, please give me a call, shoot me an email. Either myself or our grants coordinator, Nicole Milliman, will hopefully be able to help solve your frustration very quickly. We don't want anyone to get to a point where they're not, where you're so frustrated you just want to throw up your hands. We don't want that. We want to help support you. And we'll get into our GEMS program next. So with that, I am going to I unmuted everyone, so does anyone on the phone have a question? If anyone online has a question, you can submit it using the chat button at the top. Any questions?
Hi,
Okay.
Megan?
Yes.
It's Tim at Howland Hospital. I just wanted to clarify, when you talked about your new community assessment, and I think you said that that was going to be available at closer to the end of the year?
Yes, the final version will be hopefully approved in early January by headquarters, because you know there's a long process to go up and down with this. But the first two sections, both the quantitative data report and narrative, as well as the health system and public policy assessment, will be available on the How to Apply for Grants website of KomenMichigan.org.
Okay. And when will those be available?
They should be up there shortly. If they're not, I'm going to check right after this, because I sent the updates for our website, but sometimes it takes a little bit of time for those to get made.
Nope, that's what we needed to know. I'm looking at your deadline.
And it's not there yet?
And, no, we haven't checked for it. It was just I wanted to make sure we'd have a chance to look at it before the actual grant deadline was coming up. So. Oh,
absolutely. And you'll see in the data report, there's a wealth of data provided from Komen headquarters that they aggregated from National Cancer Registries, SEER, and other sources, American Community Surveys, and other sources. And so there'll be a data file that's about 80 pages. There'll be a narrative that looks at what that actually means for our communities, and that should be about 20 pages. And then the HSPPA narrative, I think, is 7 or 8. So
great.
A little bit of reading, but a wealth of data for you to use for this application or any others.
Very good. Thank you.
Okay. So the next question I have is about how to get through the registration page. And luckily, that's our next slide. So let's start into that. And I'm going to go ahead and mute you guys again, and then we'll take questions at the end. Okay, so now this is the really fun part, right? It's our grants e-management system, GEMS. I thought if I put some really sparkly photos, you guys would appreciate that more. So here we are. Many of you are already familiar with our grant system, but some are a little bit newer. Komen started switching over to online grants in about 2011, and I think our last affiliate moved over to it in Michigan in 2013. So for some it's a little bit new, but for others it's been around for a while. Our grant system helps centralize our files. It is a single place where you're going to go to get the information you need for the grant. It also gives us, as Komen, as a national organization, a way to aggregate our data. So with that, I just want to give the caveat that GEMS is a system that we've had for a number of years now. If any of you are familiar with electronics and software programs, you'll know that they update very quickly. GEMS has not. We have had some updates, but generally it's something that you probably are going to want to have your user manual open next to you when you're doing the application. And I'll give you some other tips for that as well. But understand that there's some tricks to the system. If your I's are not dotted and your T's are not crossed, it's not going to work properly and it won't tell you which I or which T was the problem. But oftentimes, if you get stuck there, give me a call and we'll figure out where it is and take care of it together. So there are two main user roles that we require for every grant applicant. The first is the project director. This is the person who's going to be the lead contact. You're going to be the one that I send the emails to that said, hey, this is due, get ready for it. And it's going to be the person most likely that's most active in our GEMS system. It's also the first person that registers for the system. And we'll go through that process in a moment. The next role is the authorized signer. This is the person or persons who are responsible for electronic signatures on your applications and for your grant contract if funds are awarded. We found that in some very large organizations, sometimes there's 3 people that have to review and sign off on a contract. And I found out this year that there is a way that we can have all 3 of those people have their own authorized signer ID, so that they have to, if someone does a submission and someone does the contract and someone else does the reporting, that's fine. We'll get it set up for you. Alternatively, other organizations create a single authorized signer user that 3 people have the access and passwords to. However you decide to do it internally, we just need to make sure that the authorized signer is not the same person as your project director. If you're working in a very small organization, your authorized signer could be your board president, or it could be your board vice president or secretary if the board president is the one that's the project director. We just want to make sure that we always have 2 people that are aware of the grant and good contacts for us in case we need anything. If either of these roles change during the course of your grant, either before award or afterwards, notify me in writing as soon as possible, because I need to be able to update my contact information and need to make sure that the Komen grant is part of the transition plan, so that if anyone needs help, they know to contact us and that this is something on their radar. So make sure if there's any changes to send us an update. There's 2 other roles that might be useful for you. One is the role of viewer. This is someone who can't save, can't add, can't edit, can't change anything, but they can see everything there. So this might be, if your organization has an oversight requirement, this might be a good user type for the oversight person, where they're not going to make the modifications, but they're going to be able to at least see. And then the other user is a writer. So if you have a grant writer, this user profile will allow you the authority to modify the application, to make changes, but you won't be able to change the status of the application. You won't be able to approve your authorized signer when they register. It's just going to be able to edit. Okay, registration. So our registration website is http://affiliategrants.komen.org. And that is also, a link to that is available on the How to Apply for Grants section under Community Impact on komenmichigan.org. So you can open up that website. I would strongly suggest to use Chrome or Firefox. Internet Explorer does not work well with the GEMS system anymore. So again, Chrome or Firefox are going to be best when you open this up. And once you do that, bookmark your site and you'll never have to remember that again. So to register a new user, you'll see at the bottom of the page here that there is an arrow on this screenshot that says, if you're a new user, please register now. So go ahead and click that link and you're going to open up a page that looks like this. It's got a number of blanks, and then in the middle of the page, you'll see this question that says, what is your position at the affiliate? Well, you're an applicant. And once you select that, you'll see next to the box, there's a little pink Go button. This is the trickiest part, I think, of GEMS. This little pink Go button means that you are selecting what is in that drop-down menu, and from that, it will then populate the next form. So you'll see that once you select Applicant and hit the pink Go button, nothing will actually happen. But if you had selected Grant Reviewer, you would have gotten another 20-form page to fill out about conflict of interest and that kind of stuff. So that's why that pink Go button is important. Once you select the state as Michigan and hit the pink Go button, that's when the affiliate drop-down is going to populate. Until that pink Go button is hit, your affiliate drop-down is going to be just about 2 spaces and nothing in it. So make sure to hit that pink Go button. Your page will do a little blink to refresh, and then the affiliate drop-down will be there. So this is where we're going to divide into our separate service areas. Up until now, we've been on a single path for all the 3 service areas. This is where we split. So your affiliate drop-down will give you West Michigan, Southwest Michigan, and Mid-Michigan affiliate. Just pretend that affiliate says service area. That's how we're going to keep our slates separate. So once you select your service area for where you operate, you hit the pink Go button again, and you'll all of a sudden see a huge list of organizations that have ever applied or registered for GEMS. So from that drop-down menu, you can select your organization if it's already existing, and if it's not already existing, you'll select Other, and then as soon as you hit that pink Go button, you'll have a number of new fields that open up that'll provide the name, the address, and other contact information for your organization. And then the final step is to select your username and password. Your password you should write down. I know that seems silly to say that, but I really want to encourage you to save it somewhere because you only get in the system every 3 or 4 months. And I don't know about you, but there's so many passwords, I forget it a lot. So I actually save GEMS as a contact in my Outlook, and I keep all of my 12 usernames and passwords in there because it's a lot to manage. If you ever have an issue with your password, email me. There will be a little button that says Forgot Password. That will give you a form that will send an email to our info box, and I won't get to it to help you for probably 24 hours because that won't be forwarded to me until the next day. If you email me, I can immediately get in the system if I'm next to a computer and update your password for you. So just make sure if you need any password help that we make sure that that's taken care of with you and I so that we just cut out the whole middleman of an auto-generated info email. Okay, so once you're registered, up at the top of the page there's going to be a little pink Save button. That's what you're going to hit, and then it'll say your information was submitted. Once that happens, I should, theoretically, get an email automatically from GEMS that says a new user has registered. However, that doesn't seem to always be the case. So feel free to shoot me a quick email and say, hey, I just registered. Can you approve me? I'll make sure to go in there, check everything's accurate, and get you access right away as soon as I'm at a computer. So this is the same form that your authorized signer will use. The difference is as soon as they hit the Save button, you get the email as the project director. So then you'll be able to go in and approve them under your administrative tasks as a project director. This is what the page for registration would look like for new organizations. It'll ask for your organization name and type, contact information, federal tax ID, and then this is also an option for you to upload your nonprofit documentation so that it's right there in easy access for you. So I will approve you as a project director. You will approve your authorized signer. Let's see, and that's where we are. So the project director, I'm hoping I remembered. No. Yes. Okay, so if once you're the project director, at the top of your screen, next to the My CG applications, My SG applications, all the way down to the right, there's a little box that says My Administration. When you open that up, you'll have a single option on your page as a project director that says Approve Users. When you open that, you can search just for the first name of the person that you're approving and hit search, and their information, their registration page will come up. So that's what that looks like that we're looking at on the screen right now for those who are looking at the webinar. You'll see that you want to approve the user, you want to assign their organization, and then you want to set their role. In this case, you'll be setting their role to authorized signer. If you know your authorized signer has a term that they will no longer be your authorized signer for, please include an inactive date as well as the active date. If you expect that person to continue working with you on the project, feel free to leave it open-ended. But that's an easy way. If you know that your treasurer only has a 2-year term, you can just make sure that they're no longer going to have access at the end of that. So once you select the little checkbox next to your authorized signer's name, set their role to the authorized signer, and hit approve, they will officially have access to the system. And again, if you need any help with this, feel free to let me know and we can help you walk through the process. So here is what your home page looks like when you log in. You'll see at the top, I think I actually have a little pointer here that I can use. Let me try that. Up here, you'll see you have My Home, which is your home page. You also have My CG Applications, which is where you're going to spend the most part of your time in GEMS. My SG Applications next to it is for small grants. So CG Community Grants, SG Small Grants. And then you have My CG Reports, My Letter of Intent, and My SG Reports. You actually might not have My Letter of Intent even on there because we decided not to do that this year. Below that, you'll see the My Administration tab that we discussed. My Organization will bring you to your organization's profile. So if you move, you can update the address. If you get rid of a fax line, you can take that out of there, although I will generally never fax you. We'll use email instead. You also have My Profile, so you can update your name or your password yourself if you want to change that, and then log out as well as next to that. On the main part of your home page, you'll have this nice little Welcome Project Director, and below that you'll see View Available Proposals. So this is how you initiate your application. You want to view the opportunities and you want to start the application. Once you actually start the application, you'll be able to find it again using the My CG Applications tab and search, and we'll walk through that together. Went too far. So once you open the View Available Opportunities button, you will see a page that looks like this. It'll have the opportunity name. In this case, it'll be CG 2016 MI 10 whatever. And then below that, you'll say Apply Now. So you click the button to say you want to initiate a new application, and then it's going to say, are you really sure? Yes, you're really sure. You want to do this, please move forward. So you'll say, I agree right here, and then it'll open up the application menu. Once it opens up, you can start working on the forms and save documents as you go through. But the way that you find it again is using the My CG Applications. This can be particularly tricky. We've had applicants start a dozen applications and complete them each partially, and it can get really frustrating when your work doesn't seem to be saving. So just make sure to use My CG Applications in order to find it again. You'll search for CG Application 2016 and hit the search button. Don't fill out your organization name, don't fill out the document name, don't fill out any of that. The fewer things you fill into search in GEMS, the better. So just select the application year, 2016, and hit search, and then you should see your application pop up. And the application name will look something like this: CGA 2016 MI 10 something, an org designator, and then a number. That's called the application ID, and if ever you see that on the screen and it's a blue hyperlink, it'll bring you back to your application menu. So that's a little navigation trick there. So here's what your application menu looks like. You'll see at the top, we see the document ID, which will again open up this page wherever you see that. The first section on your application menu is the Forms section. This is where each page of the application is contained. The next section is the Status section. This is where you will change to authorized signature required for submission, or you will submit it if you're the authorized signer. The next option is Access Management Tools. If you want a PDF copy of your completed application, this is the place to find it. It's also the place to add or remove people from documents. So let's say you started off with one authorized signer and then mid-year it changes. Well, your new authorized signer signed up, but because this document was initiated after they joined or before they joined, they're not going to automatically have access. You have to grant them access. So this is where you can do that. You'll just do an add. You'll click the link that says Add Person. You'll search for their first name, and then you'll set their role on the document. And if you ever need to do that, I'd be happy to help with that. And then the final section is Examine Related Items. This is where you're going to initiate any reporting. So your progress report initiation will be there and your final report initiation will be there. Once you initiate it, similar to the application, you'll find it again using the tab search at the top of the browser that says My CG Reports. But you initiate it initially through your application. This is what the application page will look like, except the sections are going to be different this year. The project abstract and project narrative are no longer there, and it's now project design. Similarly, you'll notice other changes on these pages. So just pay attention to that. You'll want to go through each one, filling out the information and making sure to save each time. Okay, so here's the really important tips I have for you. Step 1, draft in Word. Do not use GEMS to draft your content. GEMS automatically will log you out after about 35 minutes of activity, and it'll give you 3 minutes to save your work or do something on the page before you lose anything. If you didn't hit the save button, there's no saving it. Now, if you're drafting in Word and your computer shuts down automatically and you never hit the save button, you're going to have an auto-recover document that they can give you that'll give you your work back. So I really suggest drafting in Word. The other great benefits are that it's not a computer internet form. It's a Word document, so you can use your spell check, your word count, your character count to make sure that you're on top of the requirements for the field, but also it's just such a nicer way to work. Additionally, you then have that material available for other grant applications or for next year's application, rather than just having a PDF copy of it. So draft in Word and copy and paste to GEMS. If there is a character count box that you're dropping it into, once you hit the paste button, hit a space bar and it'll give you the appropriate character count. Make sure to save often. That's the last thing. The save button is at the top corner. If for some reason you don't see a save button on your page, it has something to do with the status. The status got changed accidentally. It should be in application in progress. And if it changes to something else, you won't have save buttons where you should have save buttons. So check your status, and if you need help moving it backwards, let me know. And then the other tips are to utilize the navigation links, use Chrome or Firefox, not Internet Explorer, and as always, refer to the RFA when completing the application. It's really going to give you the right information that you need to be considering when drafting. So the submission process, the project director changes the application status from the application menu to authorized signature required. Once that's done, they should also send a quick email to their authorized signer so that the authorized signer knows that they need to get into GEMS to submit. The authorized signer, either on their tasks list on their home page or by searching for the application, will navigate to the application menu. The second option is the status change, and that's where they will hit the application submitted button and select apply status. So this is what that page will look like. You'll see under My Tasks here, Open My Tasks, there should be a link directly there to the application, so it's very easy to submit. Otherwise, the authorized signer will want to go up to the top and search under My CG Applications for 2016 and then go from there. This is what the status bar looks like. View status options is the right one to pick. And then let's see, we have authorized signature required or application canceled. I'm going to suggest we go with authorized signature required. Once that's done, authorized signer gets in, they submit, and everybody gets to do the happy dance. So if you have questions, email me. We dropped the west out of the middle of KomenMichigan.org. We're not doing a Q&A teleconference because we did a live webinar this year. Sorry, I didn't update this last page. If we have any questions, now would be a great time for those. So I am going to unmute, and then I'll see if the chat works. So I did have a question that the affiliate fillable box was still blank for someone. I'm hoping that that was able to be resolved with the pink Go button. Any other questions? Okay. I think that's it. So the big review here, the application will be available September 17th-ish. Headquarters has to put everything together for us, and sometimes it takes them a little bit of extra time. So check that at the GEMS. GEMS will be able to initiate the application starting on the 17th. Initiate the application before October 9th, which is a Friday at 5 p.m., and then make sure to submit your application by October 16th at 5 p.m. That means you need to submit it, and your authorized signer actually needs to submit it. The next thing that you guys have to worry about, we will let you know if your application was approved or not by the Grant Review Committee, and then the slate will be voted on in early 2016, and award notifications and contracts will go out in February or March of 2016. The grant contracts need to be returned within 30 days, and as soon as we get that back, we'll process your check, and then you'll get your programs running starting from April 1st all the way through March 31st. So once again, this recording, or perhaps tomorrow, because I'll have a chance to run through this twice and maybe it'll be better, will be available on the website, and I'll make sure that all of the community profile sections are available as well. So with that, I think I just helped you guys find 53 extra minutes of your day you had blacked off for a webinar. But I think that's it. Any other last minute questions?
Thanks, Megan.
Okay. Thank you, everyone. I very much appreciate your time today. Let me know if you have any other questions. Otherwise, I'll look forward to all your applications.
Thanks, Megan.
Thanks for your help.
Bye.
Bye-bye.